virtual format. My name is Barbara Barreno-Paschal, and I am a board member of GlobalWE and chair of the Connect Initiative, which aims to connect members of the Harvard University community and friends with organizations leading the way globally for women's empowerment in the arts, social services, education, health, economic development, entrepreneurship, policy, STEM, and other fields. We are thrilled to have our panelists, organization representatives, and all of you here today to learn more about the wonderful and impactful work these leaders and organizations are doing to advance women's and girls' empowerment worldwide. Please note that this event is being recorded and live streamed on Facebook. We ask that you turn off your videos at this time and mute your microphones. To learn a little bit about everyone, we would like to launch a quick poll. Please take a few seconds to answer these 3 questions, and we can launch the poll now.
Just a reminder to co-hosts, we shouldn't vote in the poll because it will close it out. Thank you.
We'll take a few seconds to get some feedback with, oh, it looks like polling's closed. Can we relaunch the polling again to let a few people answer the questions? And please indicate in the chat if you're not able to access the poll. Great, we see some responses. Thank you so much. We'll wait a few seconds to let respondents answer the questions, and then we'll share the results. Excellent. So it looks like we have people from different parts of the world. Thank you so much for joining in your respective time zones. And in terms of the second question, thank you for people who have come for the first time. Welcome. We're really glad to have you here today, and for your responses about the sectors that you work in. And please feel free to put in the chat what that is, and we'll know for next time to include that sector in the poll. I'd love to hear what other it is in terms of your sectors. So thank you very much. And now we're going to continue with my pleasure to introduce GlobalWE President Sajida Ashraf, who will speak a little bit about our organization, provide some welcome remarks, and kick off this exciting 2-part series. Sajida, over to you.
Thank you, Barbara. And thank you all so much for joining us from all over the world. It's so wonderful to see you here for this amazingly exciting event. As Barbara mentioned, my name is Sajida Ashraf, and I am president of GlobalWE. Harvard GlobalWE is a shared interest group, or SIG, of the Harvard Alumni Association. We are dedicated to the empowerment of women through education, dialogue, and connection among individuals working for women's rights and freedoms worldwide. We highlight and raise awareness about issues concerning women's empowerment worldwide, including, but not limited to, education, political rights, freedom from violence, women's health, and economic empowerment. In 2020, GlobalWE was a recipient of the Harvard Alumni Association's Club and SIG Outstanding Alumni Community Award. It's actually hanging right behind me, very proudly displayed. The genesis of the Expo is based on the fact that GlobalWE aspires to be a node for women's empowerment organizations around the world. The Expo is based on an HAA toolkit and model for a nonprofit board fair that could be used by clubs and SIGs. With tremendous support from the HAA, Travis, and CPIC, and Robin Mount at OCS, GlobalWE's first Expo was held in person at Harvard's iLab in 2016 and featured organizations addressing a wide range of issues impacting women and girls. The first Expo was spearheaded by our founder, Julie Palmer, and another former board member, Tara Abrams. Thanks to my efforts, apparently, and then a second Expo was led by Tara Abrams and Louis Ruhr. The Expo was this time held on campus at HGSC, which is my alma mater, in 2017 and 2018. With much gratitude to CPIC, OCS, and HAA, as well as Kendall Jackson for her amazing support over the years. Due to the pandemic, like many others, we had to reconfigure and pivot, and we were unable to host the Expo in 2020 on campus. But we are thrilled to host today's event and expand our access to attendees from around the world. This year's Expo is a two-part event focusing on organizations leading the way for women's empowerment in the areas of health as well as education. Today's event is focusing on health, and part two on Saturday, April 24th, will focus on education. Some housekeeping ground rules. We ask that we all be respectful of one another's views. As a reminder, we are recording today's panel discussion and live streaming on Facebook, and we'll post this also on GlobalWE's social media platforms. Before I turn it over to Barbara again, who will moderate our distinguished panel, let me thank you again for joining us and express our deep gratitude to the panelists, organization representatives, GlobalWE Connect team, the board members, and the volunteers who've all worked so tirelessly to make the Expo possible. We are very excited to have you here and join us in our first ever virtual Expo. Over to you, Barbara.
Thank you, Sajida. We will begin the Expo with a panel featuring 4 fantastic leaders of organizations focusing on health. I will introduce the panelists in just a few moments. After the panel, you will have the opportunity to learn from 10 organizations who work on behalf of women and girls around the world. You should have received an email a few days ago with some slides that highlight the participating organizations' work. We will include a link to this file in the chat before the breakout sessions in case you did not have a chance to review it as a preview to the breakout sessions. There will be 3 18-minute breakout sessions and 5 rooms with 2 organizations in each room that will make brief presentations and answer your questions. Please feel free to come and go to the different breakout rooms. Each organization will have the chance to discuss its work during these sessions. Then we will return to the main room for closing remarks and announcements. As a reminder, please turn off your videos and mute your microphones so that we can spotlight the panelists during the discussion. And now it is my pleasure to welcome the following panelists today. First is Samlara Ba, founder of LuWorks. Second, Camille McGirt, founder and board chairman, Healthy Girls Save the World, Inc. Third, Sarita Sandosham, executive director and vice president, Heartland Alliance International. And fourth, but not least, Ricky Sharma, co-founder and co-president, Adolescent Health Champions. Thank you all for being here today. As a reminder to our attendees, please feel free to submit questions through the Q&A feature, chat function, or by raising your hand. Our team will bundle the questions and we will ask them after the moderated questions. We will do our very best to get to as many questions as we can. Now let's begin by learning a little bit more about our panelists. We would like each of you to give a brief 1 to 2 minute introduction of who you are, the organization you lead, and where you are based, as well as what kind of work your organization does and why women's and girls' empowerment is important to you. Let's start with Samlara, followed by Camille, Sarita, and Ricky. Samlara, the floor is yours.
Thank you so much, Barbara. Hello, everyone. Thank you for just having us today. My name is Samlara Ba. I'm the founder and CEO of LuWorks, and I'm based in Accra, Ghana. At LuWorks, our big, bold idea is really around ending preventable diarrheal diseases caused by poor sanitation in marginalized communities in Ghana. We're doing this by manufacturing toilet systems using construction materials made from recycled plastic waste. Aside from saying that the future is female, I think I'd add that the future is now. So in Ghana and across the African continent, especially with regards to entrepreneurship, we see this. We see that on this continent, more women than men are classified as entrepreneurs. In Ghana specifically, 46% of our locally owned businesses are women-led and women-owned rather, and 95% of women are engaged in our workforce. So honestly, women's empowerment, as I look across the continent, it's just become a passion of mine to allow others to see that they have the opportunity to move beyond just getting just getting married at a young age and really following their passion and doing what it is that they believe their purpose to do.
Thank you, Samlara. Camille.
Wonderful. Hello, everyone. I am Camille McGirt, and I am a second-year MBA student at Harvard Business School here in Boston. And I am the founder and board chairman of Healthy Girls Save the World Incorporated. And our big, bold problem for us, there's this truly unsettling pattern in the data. Black women in the United States have experienced unacceptably poor health outcomes really since the inception of this country. But there are very few institutions that are providing funding and resources to provide solutions. Black women are 3 to 4 times more likely to die of pregnancy-related death. They're twice as likely to have hypertension and 50% more likely to be obese than white women. And we believe that Black women deserve good health, and Black girls deserve the right to grow into adulthood without the risk of heightened morbidity and mortality rates. And so historically, we've had after-school programs and summer camps where girls get to come to college campuses and meet college athletes, cook and healthy food, learn about respectful and positive relationships, and really just get a chance to associate health and wellness with fun. Right now, we're switching to a digital delivery mechanism. So that's really interesting and exciting. I look forward to talking about that a little later. And why girls and women should be empowered. Well, women create community. And when you empower women, you empower the world, and you essentially empower the entire world and all humans to be able to successfully navigate this entire globe. So that's why I believe that we should empower women and girls.
Thank you, Camille. Sarita.
Thank you. Thank you so much for having me. So my name is Sarita Sandosham, and I am the Executive Director for Heartland Alliance International. And the focus of our work is about human rights at the intersection of mental health and access to justice. And the folks that we work on behalf of are the most marginalized and the most vulnerable. They've been impacted by extreme human rights violations and extreme violence, often in areas of conflict. We work with refugees, asylum seekers, survivors of torture, women and girls who've been engaged in gender violence. And the crux of the way we work is we recognize that to access justice, which is critical and important to get your rights, you also need to be mentally able to do that. So you're looking at the well-being of the whole person, and that's really important to us in terms of the outcomes. We're based in Chicago, and we have offices around the world in Latin America and the Caribbean, in the Middle East and North Africa, and in Sub-Saharan Africa. And we've been around for we've been around for over 12 years. And we're part of a larger organization called Heartland Alliance, which is also based in Chicago, working on issues of human rights and poverty.
Thank you, Sarita. Ricky.
Hi, everyone. My name is Ricky Sharma, and I'm joining today from New Delhi, India. And I am the co-founder of Adolescent Health Champions, or AHC. And I'm also a proud graduate of the Harvard Kennedy School. First off, I wanted to say a big thank you to Harvard GlobalWE for this amazing opportunity to share our work. And I also wanted to give a huge shout out to my fellow panelists for all the amazing and inspiring work that you all are doing. And I'm honored to present alongside all of you. We founded AHC to address the critical intersection of gender, health, and education. And I'm personally passionate about this work because I believe we need people of all genders to collaborate and work together to overcome gender inequality. It truly is a collective challenge and problem that requires collective engagement, actions, and solutions. And we started AHC because we noticed that while adolescence is a time of tremendous growth and change, many youth in India struggle to achieve their full potential due to health challenges that arise during this time in life. And those are often disproportionately impacted by gender and can have serious consequences for educational outcomes. So, for example, almost half of youth in India are anemic. Almost a quarter of girls will drop out of school once they begin menstruating. Nearly 1 in 5 will become teen mothers, and many are facing increasing mental health strain. So we think there's a really powerful solution right in front of us, and that's the youth themselves. So we use an innovative, comprehensive, and evidence-based peer education platform to support adolescent youth. And we cultivate a network of adolescent peer health educators. And these youth lead the educational process in their schools and communities on things like gender inequality and topics like mental health, puberty, reproductive health, nutrition, and gender-based violence. To date, we've supported over 6,000 youth in India, and our ultimate goal and vision is to build a comprehensive adolescent and gender-centric health education platform co-designed with our youth for the 240 million adolescents in India.
Thank you, Ricky, and thank you all for your introductions. We're really excited to get into the next set of questions. We will ask a couple of questions for each panelist, starting with Sarita. Sarita, your organization, Heartland Alliance International, provides specialized mental health and psychosocial support to victims of violence and human rights abuses. How did the organization's programs and services respond and adapt over the past year, given the tremendous toll the pandemic and economic crisis has had on women and families around the world?
It's a great question. You know, when the pandemic happened, it caused a great deal of chaos for all of our staff to figure out not only, you know, how to deal with what we were all going through personally, but then how are we going to provide services, right, to our marginalized populations, and recognizing, right, that under the current situation, women and girls were going to be adversely impacted. And I will say that we pivoted very quickly to the issues of, you know, working with virtual platforms, learning how to do that ourselves, but then recognizing that we also had to teach our participants how to do this and to create sort of a trusting environment. Because when you think about the mental health support that we were providing it in a face-to-face way. You had to go into a virtual platform. You had to recognize that the people we were supporting actually didn't understand or know how to use it, or could even afford to get, you know, phones and internet connections. And so once we got over that hurdle and we started building the trust, we then, you know, it was amazing because our staff and our participants found ways of engaging. I think the key thing in the work that we do, particularly with women and girls, is we also build their capacity to be able to provide mental health support. And so we created group psychological services. We were able to get people to learn to use those systems more effectively. We used videos as ways of connecting. And as I think back over the year, it's now become a matter of course in how we operate using technology. And I'm actually amazed that we've gone as far as we have in this last year. And I know that as the pandemic lifts, we'll definitely include more technology. But what I would say is, you know, we have to figure out also how to get back and touch people in a real way. And that's it's going to be the pendulum's not going to completely switch back. We're going to take some of this learning that we've had, and then we're going to move ahead. So that's what I would say.
Thank you. That's really important observations, and the use of technology can be helpful in some ways and challenging in others. And so I really value what you've shared. The next question will be for Camille. As Healthy Girls Save the World is focused on helping Black women and girls be knowledgeable and enabled to make healthy life choices, how do you see the work of your organization evolving and serving this community given the current state of affairs in the United States, from the social justice protests last summer to the ongoing vaccination efforts?
Yeah, great question. I always get asked the question, why Black women? And I'm often in awe when I get this question, because it's really interesting when you look at health outcomes across the board. Black and brown people almost always have the highest rates of chronic disease and mortality than almost any other racial subset, and that's even when you take into account protective factors like education and income and such. And so, to answer your question, I think that all that happened in alignment with this racial reckoning across the country has helped people to do a little bit of a better job in understanding that there are these terrible inequities that exist in this country. And I think that we're all learning a bit more about the root causes of these racial inequities, from my lens, and from what I've been reading and absorbing. These root causes are, deeply related to slavery and colonialism globally that has kind of, created this unequitable and unequal distribution of wealth, income, and power. And so, I see our work evolving, number one, because I don't really get that question anymore, or as much, why Black women only? Because people are starting to understand why. And that public awareness in itself just makes it a little bit easier, because I don't have to educate as much, and I don't have to really beat this dead horse on all of these statistics and facts that exist. And I think that people are also a bit more open to providing resources to our organization. And lastly, kind of unrelated to the racial reckoning, related to this past year, but with COVID, as the world, kind of rapidly evolves towards digital forms of engagement being just even more mainstream, there's this emerging unmet market need for virtual health and wellness modalities to really meet the needs of niche communities. And so Healthy Girls is evolving to provide a digital delivery mechanism for the girls and women that engage with our program.
Thank you for sharing that. It's good on the one hand, you don't have to educate as much on certain aspects, but there are other challenges that remain. And it's great that your organization is out there evolving and trying to find new ways to adapt to changing circumstances. The next question is for Ricky. Ricky, you mentioned that you're currently in India, where AHC, Adolescent Health Champions operations take place. What have you observed since your arrival about the health ecosystem as it currently stands, and what steps is your organization taking to train the next generation of health leaders, given the continued challenges facing India and other nations with growing youth populations as a result of this pandemic?
Thank you so much, Barbara. I think that's a great question. And in terms of our big focus this past year has really been understanding and supporting our youth throughout this pandemic. And it took a lot of time and effort and collective energy from our team, but I'm thrilled to say that we've transitioned our program to be entirely virtual. We've conducted over 50 sessions in the last year alongside of our peer educator youth champions. And we're just getting started. Unfortunately, the pandemic is trending in a challenging direction here in India. And so I think schools are going to be shut for quite a while to come. So I think there's an opportunity to continue expanding and reaching many more youth virtually. I think in terms of the pandemic, I think one of the things that's really important for all of us to think about, and especially when dealing with youth, is that while we're in a sort of acute current crisis with the pandemic, I think the impacts to youth are going to last for many years in terms of the disruption to their education and the lingering impacts on their physical and mental health. So I think we have to really be thinking about not only how do we get through this crisis, but also how do we manage the fallout and disruptions for years to come. So I think one of the ways we're really thinking about this is from a mental health standpoint. Our youth continue to report tremendous strain around the pandemic. And so one of the things we're really focused on is building linkages to mental health providers and support resources there. That is challenging in India, though, because there is a lack of infrastructure around mental health. There's a popular statistic that there are more psychiatrists of Indian descent in the United States than there are psychiatrists in all of India. And so that makes it really challenging in terms of addressing this huge unmet mental health need. And then another way that we're thinking about this is in terms of adolescent-friendly care. So once we sort of educate and give youth with the education and knowledge and awareness about their health, how do we then connect them with the care that they need? And so despite having the world's largest adolescent population, there's often difficulty for youth to get adolescent-friendly care. And what that means is providers oftentimes feel ill-equipped and unprepared to deal with discussions like things about sexual and reproductive health or mental health when dealing with teenagers. And as a result, youth feel sort of stigmatized and uncomfortable going to these settings to seek care. So I think thinking about the ecosystem and kind of how we wrap around this support around our core peer education platform is what we're focused on for the next few years.
Thank you, Ricky. And you made a really interesting point about, obviously, it's not just about reacting to the current situation, but years to come, generations to come. How is the work you and other organizations are doing going to impact those generations as well? It's really important to keep that in mind. Our next question is for Samlara. In a time when more attention in a long time, and perhaps ever, has been paid to sanitation practices, how has LuWorks collaborated with waste management providers in the areas it operates in to rethink sanitation solutions, and how has the past year impacted your company's long-term vision about its impact?
So I suppose in answering this question, it's easiest to start with the fact that we've collaborated with traditional waste management companies and traditional healthcare companies to really access or to seek to advocate for vulnerable populations to help them understand how easily just germs are transmitted from person to person. And that sounds simple enough, but in the beginning of the pandemic, Ghana went into lockdown for 21 days. And we have so much of our population that if they don't work, they don't eat. And so being able to now get out and help others understand the need for the lockdown, the need for us to be mindful of transmission or of any type of transmission was daunting to us from a team perspective, because just the vernacular, the language around social distancing didn't exist in our local languages. Just the languages around even explaining the virus. Ultimately, you find people translating it to poison, or so we found real prohibitive terms. We found real issues with the way we talk about sanitation, the way we talk about viruses, the way we talk about healthcare. Now, as we dug deeper, those activities really helped us to take a new look at just approaches to global health access by means of how we learned from what sanitation access looked like in the beginning. So what I mean by that, one such learning I'll use as an example, is that we found out that our households were inhibited or weren't able to garner a toilet simply by small basic processes in the ways payments were made in the beginning of LuWorks. So traditionally, we had payment systems, payment structures that might have been, hey, if you pay monthly, we'll go ahead and install a toilet. Households just didn't understand that, but when you brought it down to being able to pay daily, then it clicked, and they were paying at much higher rates than if we were asking them the monthly rate. So in that same vein, when we started talking about local companies tackling global health access, we found one of our colleagues, one of our partner companies, was tackling this barrier to healthcare access because our local systems, in the U.S., you have copays, you have ways in which people can walk into a healthcare facility and garner healthcare because they're in some imminent danger, something is troubling them. In Ghana, what we found during this time frame was that people started talking to us about the fact that, you know, I wouldn't go into a healthcare facility because I have to pay for a folder. We are still quite manual. And so by saying I have to pay for a folder to have my name on the books of this particular healthcare facility, that to them was prohibitive. I have to pay all these fees essentially before I get to the point that I actually see the doctor, to them was prohibitive. I say this is a long way to say that we really learned that that barrier to healthcare access essentially could be the difference between them having a very small tumor that just grows because they wait too long. It could be the difference between a minor issue turning into something quite major as a result of that there are too many barriers to get to actually see the doctor. So what one such company is doing now is creating this community funding model, creating this model that allows you to directly go in and garner access, and you pay it back in kind in different ways. And so we're actually looking at our own system, not just at LUWorks, but aligning with a few sanitation companies locally to see how we can do that for our most vulnerable populations, how we can create community access so that it's not that they have to pay up front. How do we ensure that they pay on the back end, almost in kind in certain situations, but ensuring that they garner the toilet up front. So we've actually, during this time, it's been many learnings for LUWorks as a result of the collaborations within our waste management spaces and our healthcare spaces.
Thank you. That was fascinating. And what I found most interesting is the ability to understand how people think and how they respond to certain questions or prompts, and learning that and making it so that people can understand what they're being asked or what they're being offered, so they can maximize that and be part of a system that works for them, not something they don't really understand. So that was a really excellent example, and thank you for sharing all of that helpful information. Our next question is for Camille. What opportunities have been or will be available for your organization to partner with state and local health authorities and schools to encourage healthy and balanced lifestyles? And are there stakeholders you have engaged with who you would have not expected to engage with when you founded the organization to promote its mission?
Yeah, another great question. You know, I think that historically, when we got started, there weren't a whole lot of, new founders, or new partnership opportunities that surprised me. But I think that with this evolution of Healthy Girls, now where we are with COVID and such, there have been. So, historically partnered with schools and local and state health authorities. And that, truly has been a core component of our model over time. Bringing middle school girls to universities and partnering with these institutions just has allowed us to utilize this wealth of resources in the public school system in North Carolina, the K through 12 system, and at the university level as well, to kind of keep our operations going. But, historically, we have not had any online programs. We've been heavily in person. And this new evolution of Healthy Girls, it'll be this online platform for Black women and girls that aggregates user-generated content, health content, for Black women and girls, and it will also incorporate curated content directly from Black female health influencers and experts and ambassadors, and that content will be monetized. So essentially, it'll be the centralized repository of high quality videos and content featuring workouts and skincare routines and meal recipes and twist out methods and Black girl meditations and essentially all things that fuel Black girl magic right in one place. And so, we'll partner with existing wellness influencers in this space to create content that we can use to continue to elevate that excitement around health and wellness for Black girls and women. And, a year ago, I didn't know that we would be in this space and looking to create partnerships like this. And, another partnership opportunity that we foresee, this is very audacious, but down the line, we hope to be able to partner with companies like Peloton and Apple Fitness Plus and Nike Fitness for content creation and distribution. So this is something that I'm really excited about, and I truly look forward to our transformation over the next few years.
That is really exciting, and we really hope that you can get those partnerships going, because it'll be a wonderful way to connect the girls to these fantastic companies and organizations and leaders and encourage these healthy lifestyles. So that's amazing. Okay, we're going to do one more round of questions for each speaker, and then I would love you all, if you have questions, to start putting them in the chat, or if you'd like to raise your hand and ask the panelists directly, we'll give you a few minutes to do that as well. So we're going to do one more round for each panelist, starting with Ricky. Your organization is in the midst of several research projects, including evaluating your model's behavioral impact and the organization's mobile app. What is the time frame for these projects, and how have you engaged community partners and other stakeholders to recruit participants for these research projects?
Great, thanks, Barbara. So similar to Camille, one of the things that we're really excited about and leaning into is sort of digital opportunities. And we are really, really excited about our AHC mobile app. For many, many years, our adolescents have been telling us that they want some sort of digital platform to sort of deepen their engagement and stay in touch with us. Given our program is in person and in schools, but they wanted something that would help facilitate sort of ongoing engagement with the program and with our organization. So obviously the pandemic was a big catalyst in terms of getting this off the ground and moving it forward. And so we've spent the past 6 months developing and designing the app. One of the most exciting things about the design of the app is that we've been doing it alongside our youth. They have been sort of intimately involved in all aspects of the app's design, sort of thinking through the structure and functionality and content. We really wanted to make sure it was something that would resonate with them and something that they would actually use. And the best way to obviously do that is to involve them in sort of the full design process. And so the mobile app is going to be one of, we think, one of the first of its kind in India in terms of providing youth with adolescent educational content from a health standpoint, activities to promote healthy behaviors, and the ability to access further support if they need it in things like mental health, like I mentioned earlier. We're really excited. We're launching this month, actually, our pilot of the app, and we're going to be launching with 200 youth in a few of our partner schools. And the goal is to do a broader rollout in the second half of the year. Once we've evaluated the pilot, sort of made sure the app is achieving the impact that we want and making any necessary tweaks. And I think this is one of those examples where, in the pandemic, we've obviously had to upend our models and way of going about things, but we're hoping that this investment in the app is not only a resource during the pandemic, but that it's hopefully something that'll allow us to reach many, many more youth in the years to come, hopefully once we're past the pandemic. And I would say we also, as an organization, take a lot of pride in research and sort of being evidence-based in everything that we do. So we're really excited to keep thinking about our virtual platform and how we're doing these virtual sessions, kind of understanding the impact of that model and maybe incorporating some of the things that have been effective going forward. So I think there's a lot to learn and digest. And I think we have a lot of different levers to pull in terms of realizing and achieving impact with our youth. So definitely been a learning process, but definitely have gained a lot and gotten stronger as an organization because of it.
Thank you. That was really exciting to hear, and having knowledge of the state-of-the-art app is on the horizon and it's being developed is really exciting, as well as thinking, like you mentioned, ahead to the future and how this type of information and research can inform future generations. It's really wonderful. Okay, we have another question for Samlara. Your company is in an exciting growth phase by engaging in a seed funding round. What has this process been like, and to what extent does the subject of women's health or empowerment come up during funding discussions like this, given the additional sanitation needs of women and girls?
Great question. Thank you. I will start by indicating that, yes. So what has the round been like? I'll say that we started this round during a time where, as a Black female founder, I have to be very mindful of any type of alignment with any investors with our vision at WeWorks. Because what I'm finding right now, as much as it's exciting to see that maybe opportunities that wouldn't have been available 5 years ago, I'm finding people are reaching out to me, but are they a correct fit? Because I might just tick a number of boxes. I'm Black, I'm female, I'm working with marginalized communities in Africa. And so that may work for some people, just to tick a number of boxes. And we have found that we actually have to be mindful of our value alignment. But beyond that, I have to say that the outpouring of support has also been remarkable. Honestly, we've had just quite a bit of support from local entrepreneurs, and we find ourselves creating just a funnel to be able to support other local entrepreneurs in the future, just as far as resources and people who could potentially invest in them. Now, as we talk about women and girls, I have to say that in communities lacking access to household sanitation, it typically falls on girls and women to collect drinking water and provide adequate disposal of sanitation. I want to say that to everyone because this disproportionately hinders their productivity and their health, as exposures to toxins and waste is obviously a Sophie tax that is on their shoulders. Now, I say this because our work aligns to alleviating that need to spend time in that water collection and sanitation disposal, and ultimately allow these women to engage in activities more in line with economic productivity. So our short-term and long-term goals at WeWork really allow us to create spaces for economic empowerment for our women. So that does come into our funding discussions as we get into our due diligence phases, as we look at alignment. We want to make sure that people understand, why we do what we do and the pieces that are negotiable and non-negotiable. So when we talk about advocacy and education for our girls, we have a for-profit model, but this component is not going away. So it does come up when we dig into our vision for growth. And honestly, we're seeing a lot more engagement from our financiers, from our investors, as the world seems to be giving them reasons why women matter in economic development. So
I love to hear that there's been increased engagement and that there's an opportunity to help other women founders and people leading similar organizations, because on the one hand, it's great that you're successful, your company grows, and it's even better to share that wealth of knowledge and information with other companies that are similarly doing important work. So that's wonderful to hear. Our next question is for Sarita. As the leader of a global organization, what is your vision for greater global collaboration between Heartland Alliance International's different programs, and to what extent will innovations in technology and remote work make this collaboration easier or more challenging?
Yeah, it's a great question. So I think it's clear that, from the perspective of Heartland Alliance International, collaboration is really important. Building trust to address the kind of human rights violations we're talking about around the world, critical. And so that's going to deepen, and we want to deepen our impact in the countries that we're in. We want to expand the work that we're doing in these countries. And I'm also thinking about, how as an organization, we become known, right, for how we work on the cusp of mental health and access to justice. And as I was listening to my fellow panelists, and I'm listening to particularly Ricky, who's talking about mental health issues with adolescents, I think that there's a way there, right, for Heartland Alliance not to be in India, but to actually perhaps support Ricky's organization in terms of the way we've provided capacity building for community-based organizations to do the critical mental health support that people, women, girls, vulnerable people need, right, in order to live productive lives, in order to access justice. And I think that that's something that is absolutely necessary now, particularly after this last year of the pandemic, when mental health has become a big issue. It should have been an issue before, thinking about, you know, the well-being of human beings. But now that everybody's recognizing that, there are organizations that are already operating and operating locally and adapting for, you don't need psychiatrists, and you certainly don't need psychiatrists from US to support you in mental health support. So that would be the thing that I think is really important for us as a global organization, recognizing what we've done and lifting that up. Oh, and can I just add, in terms of the, using technology, I think you can use technology, and I think it's important. We also have to recognize that a lot of our populations are poor, right? And they're operating in Black areas. How we have to then figure out, right, what is the way to meet them halfway, and we have to figure that out. And that's actually understanding the context in which you're working. And it needs to be part and parcel of the way we operate.
I really value what you said about capacity building, and that's critical, right? And it's something I think about a lot as well. I think about organizations that are providing services on the ground. Does there need to be a replication of that model, or can there be capacity building to support that model? And also being considerate of the fact that people live in areas that technology access is impossible or very difficult. It's important to keep that in mind as we think about the increasing innovation capacity, but also the realities that still exist. I would love to open up the floor to people from the audience to ask our panelists a couple of questions. We have about 7 minutes until we transition to the breakout sessions. So if you would like to ask a question, please raise your hand or put the question in the chat box and we will take it in turn. And I don't know if there are questions already set up, but we can get started. I see one question already. Okay, so this is from Leah, who is a board member of GlobalWE for Sarita. Can you detail what your partnership model of operations looks like, perhaps with an example of a current partnership or as a possible one with one of the panelist groups?
So when I think about our mental health support that we are working on in places like Colombia and Iraq, what we've done is we've worked with local organizations. And in Colombia, particularly, we've been working with folks who have been impacted by conflict and violence. And we're working with Afro-Colombians and indigenous groups. We work with local organizations that work with those populations. And so we build trusting relationships with those local organizations. We then build their capacity to be able to provide mental health support. And what you realize is that, we're in this for the long haul. They're not just, projects for 2 or 3 years. When you're talking about mental health support and you're talking about access to justice, you're talking about year on year on year. And so these relationships are really important. And then the other piece is working with local government, because we as one organization are not going to be able to make the kinds of changes we want to see or create the systemic shifts. And so partnering with local government is important. And our best relationships have been in the countries where we've had the longest engagement. So Colombia is one, Iraq is the other, and the third I would say is Nigeria. I hope that answers your question.
Thank you, Sarita. Other questions from anyone? We still have a couple more minutes. I have another question, but I wanted to see if someone else, anyone had, okay. Another question for Sarita. As you talk about local people and most poor people do not understand English, my question is, do you partner with local, representatives of that area, maybe translators or other community leaders to reduce language barriers?
Well, this is a great question because it really speaks to our staff. All of our staff are local. So when the pandemic happened, we didn't have to take staff and evacuate them back to Chicago. They remained. They were part of the infrastructure. So that there are no language barriers because you're hiring local staff. And that's what I'm pretty proud of. We have 467 staff around the world. And one of the things about the pandemic has been to learn from them about what to do in those situations. And so there aren't any language barriers because they're all local.
Thank you. I just want to ask a quick question of the panelists. Whoever would like to answer, please do. What is one aspect of your leadership style that's changed during this time? And what is an area you'd like to develop in order to improve relationships with staff and board members? Camille, for example, you're chair of your board, or you have been chair of your board. What are some ways in which you'd like to improve those relationships, or what have you learned from this experience that will help you do that?
Yeah, I guess for me, one element of my leadership style that has changed is I think I'm a little bit more comfortable with failure. Speaking of mental health, I've had my own issues in the pandemic, and I've been in therapy and talking to my therapist about just my paradigm of the world and how I see things, and I've been just learning more about on this entrepreneurial journey, you're going to get told no 5 million times, and you just have to be extremely resilient and keep your eyes on the vision. And if you get knocked down, it's okay. It doesn't mean that everything is over and that you just have to give up. But failure is natural and it's going to happen. And I think that I'm a lot more comfortable with it now and at this point in my journey. And I'd say as far as, kind of, I guess, elevating partnerships and such, like with my board, I'd say just like people in general, I think that I'm being a lot more tactical about how I kind of am, that stewardship when you're talking about like, building and maintaining relationships. I think that a lot of times when you're an entrepreneur, you just meet a lot of different people. And sometimes, some people can be really helpful. And then sometimes you just have a conversation, they give you some advice, and then you kind of move on. But I think that, for me, I've just been a lot more intentional about making sure that I keep up with all of these people that I'm meeting, such that, down the line in 3 months or 6 months or 3 years, if I want to reach out to them, it's not a cold call. It's a warm hello because we've been in contact. So.
Thank you very much. Ricky or Samlara, would either of you like to respond or add anything before we transition and conclude the panel?
Yeah, I can quickly add to that. I totally agree with Camille. I think during this time, it was really easy to put a lot of pressure on ourselves and sort of feel like we have to know the answers and we have to pivot, we have to do it fast. Otherwise, there'll be consequences. But I think it was really important to accept and learn that we don't know the answers because these are unprecedented times. And so I think it was really important for us to kind of step back as an organization. We really, really focused on listening to our youth and hearing what they needed and what they were thinking. And that one thing led to another. And then we ended up forming this youth advisory board, which is a structured body of representatives from all of our schools. And I would say this is the sort of proudest accomplishment during the pandemic because these youth have been so involved in every step of our organization now in terms of strategy, implementation, program design, and execution. And so I think taking that step back and accepting that we don't know the answers and asking for help and asking for support and listening to people and sort of being intentional, I love that word Camille used, I think has been really useful. And totally agree about the mental health front. I think it's really important. The work that we're all doing is challenging. There's a lot of frustrations. And so I think fostering and creating open cultures around mental health within our teams and sort of being really supportive and open about that is something we want to keep working on as an organization as well.
Thank you, Ricky. Samlara, is there anything else you'd like to add?
real quick, I'll add that during this time, I think that I was much more accessible to the outside world, but almost a little less accessible to my team, simply because of some of the things that have been mentioned as far as access to technology and bandwidth and what have you. And so, so what we found though was that I found that I was blocking real time for personal well-being, A, but B, team well-being. And now we have instituted some time where our team is starting to just feel a lot more comfortable on a biweekly basis, actually sharing in ways that wasn't traditional locally. We always blamed it on culture, but it wasn't real. It was, we weren't making the time for it, and we weren't taking the initiative to be intentional about really digging deeper in giving people space to just feel or be. And so we've blocked that time into an all hands meeting. And so that's really different for us. And we've been enjoying it for a few months, and we've been seeing that people are actually working together in stronger and better ways than we could have imagined. So, yeah.
Thank you so much. Thank you for everyone for your questions and for the panelists. Just real quick, I want to mention that once you complete the survey for this event, you will get more information about these organizations. You've received a file with their information already, and we'll give you more information so you know how to get involved, because I think they would all appreciate your involvement in many different forms. So you'll get more information about that. At this time, I'm going to transition. Well, first of all, I'd like to thank the panelists so much. Thank you for your valuable insights and perspectives today. We really value you taking the time to join us and share those. And I would like to transition to Sajida, who will talk about the next portion of this event. And this event will no longer be recorded, just